Good evening, everyone. Welcome back for another interesting session on Doctor Speak. Hope all of you are safe and doing well with your families. Before we start today's session, I would like you to click on the like button and let me know if I'm audible and whether you can hear me clearly. I would also request you to type in the city you're from in the comments box. A sincere request to all you lovely people in the audience. Share about this initiative in your network. Let your friends, family, even colleagues at work know about this initiative. It's an opportunity for you to get first-hand information from the medical experts, from top institutions of the country who are coming on a platform and taking time out from the busy schedule, talking to you about different health-related topics. And there's so much one can know and learn from these things and implement in their daily lives. I can see comments coming in. I know I'm audible now, and I think we are ready to go and start our session. So, first of all, let me tell you again a little bit about Doctor Speak. Doctor Speak is an initiative which we commenced in the month of July through a 12 episode series of live sessions. Through this initiative, we focus on providing relevant information and creating awareness about different health topics. On this platform, we bring renowned doctors from top medical institutions and who are experts in their field of specialization. They will talk to us on different health topics, and then you have a platform wherein you're able to ask them any concerns, any queries you have pertaining to that topic. And till date, we've conducted a series of sessions. They've been around vaccination, around the mental health. We had a session on cancer, ENT care, and the latest one which we did was last week around World Heart Day, which was to take care of one's heart. Coming to today's topic, let me tell you a little bit about it. There are around approximately over 37 million cases of asthma in India, and the recent studies have reported a rise in the cases of for allergic rhinitis and asthma as well. Overall, 40 to 50% of pediatric asthma cases in India are uncontrollable or even severe. This disease can make breathing difficult, it can trigger tremendous coughing and even shortness of breath. And as it turns out, allergies and asthma often occur together. The same substances that trigger allergic rhinitis symptoms, such as pollen or dust mites, may also cause asthma. In some people, it's even skin or food allergies that can cause asthmatic symptoms. So, today, let's get to know more about this topic: asthma and allergies, a common persistent problem. This session will be addressed by Dr. Aditya Agrawal. He's a consultant pulmonologist, and his special interests are in treating asthma, allergies, interstitial lung diseases, and even COVID 19. Currently, he is the director of the Opera House Clinic and is also associated with Bombay Hospital, Wockhardt Hospital, Parsi General Hospital, Bhatia, and St. George's Hospital. He's an MBBS from the Rajiv Gandhi Medical College and also a MD in Pulmonary Medicine from DY Patil Hospital and Medical Research Center. He's completed his lung cancer fellowship training from the Department of Pulmonary, PGIME, and DNB Respiratory Medicine from New Delhi. To name a few of his past associations, he's been associated with National Institute of Tuberculosis and Respiratory Diseases, Apollo Hospital, Bombay Hospital, and the DNB Respiratory Medicine in New Delhi. Good evening, Dr. Agrawal, and a very warm welcome to you on our live session of Dr. Speak.
Thank
Thank
you
you
so
so
much
much
for
for
inviting
joining
me.
us, Doctor, and sparing time from your busy schedule. It's a pleasure to have you on our platform. Thank you so much for taking up the time and being there with us.
Thank you so much, Raj. Thank you for inviting me. Uh, I actually love the topic of asthma and allergies, and this is my lifelong passion. Uh, I'm an asthmatic, and a lot of my family members also asthmatic, and that got me, you know, starting to love the field of asthma, which got me so interested that I've spent my entire life now doing research on asthma and allergies and treating everybody who has these problems. So
Wow.
I am a consultant at the Bombay Hospital, and I am the director of the Opera House Clinic, which is at Girgaon Chowpatty, Mumbai. Uh, Allergies are nature's way of getting back at you. Patients who have
Doctor,
allergies,
Doctor, I will just
yes.
tell you about the flow of the session. So you may
Yes.
start with your presentation, and once you're done with the presentation, I'm sure we'll have so many queries, concerns from the audience, and I request everyone in the audience think through what you would like to know about asthma and allergies. Put it in the comments box and get all your questions answered by Dr. Agrawal. So I hand it over to you, Agrawal. Thank you once again.
Thank you. So, I have this lifelong passion of treating asthma and allergies, and I'm going to speak to you about what these are. Now, allergies are a way of nature getting back at you. Uh, Allergies, what's an allergy? Let's see what an allergy is. An allergy is an abnormally excessive reaction to a harmful stimulus. So basically, what this means is that your body is reacting in an abnormal fashion to something which is bothering you, something which is irritating you. So somebody who is allergic to something, when he is exposed to that particular thing, he will try to repel that thing. And while repelling, what he would do is he would harm himself. And that's allergy for you. Now, no two persons will have the same degree of allergies. That means no two persons would have the same level of response or the same intensity of response to a particular allergen. You may be two different people with different types of allergies, and both have exposure to the same allergen, but one may react differently and the other another, and you may have allergy of any part of the body. So it's not specifically the nose or the lungs only. You may have allergies of the skin, you may have allergies in the eye, nose, mouth, skin, lungs, abdomen, and so on and so forth. Now, what are the types of allergies and their symptoms? Now, we know that patients may have food allergies, skin allergy, dust allergy, insect allergy, drug allergies, and even nasal allergies, which is called allergic rhinitis. I will I will speak about each one in significant detail, but how do they present? Or how does a person know that he may have food allergy? Such a person who comes with complaints of vomiting, stomach pain, loose motions, or rashes after eating a certain type of food may be somebody who's very likely to have food allergy. Skin allergies presents with different types of skin manifestations such as rashes, hives, itchy bumps, etc. And patients with dust allergy often have a teary eye, sneezing, coughing, they may be breathless. Insect allergy patients usually complain of pain and redness, along with an itch over the part where the insects have bitten. Patients with drug allergies can have anything from a rash to urticaria to shortness of breath, and so on and so forth. So, drug allergies are extremely difficult to identify. Patients with nasal allergies often have a runny nose, a blocked nose, or may have only sneezing or a nasal twang to voice. Now, when we speak about food allergies, what are the most common allergens? So, now for something to qualify as an allergen, they usually need to be proteinaceous. That means and they need to be of animal or plant origin. Most often, we find that patients have milk allergies. The second most common type of food allergy are eggs. Fish and other seafoods are another common form of food allergies, especially shellfish. A lot of patients have tree nut allergies, and we see a lot of patients complaining of peanut allergy. Now, peanut allergy is not as common in India, as it is in the West, but nevertheless, we are increasingly seeing peanut allergies in the Indian population too. Hence, it's advisable that when a parent is giving his child peanuts or peanut containing substances, they should make sure that the child does not have allergy to such a thing. Especially, it's become mandatory now for restaurants and packaged food to mention if they contain peanuts. A lot of patients have gluten allergy, which is basically wheat allergy, and not so common though is the soybean allergy, which we see in very few patients in the Indian population. Now, how do patients with food allergies present? What are their signs and symptoms, or how would you know that you may have a, had a food allergy? Patients may have eczema, which is a chronic rash. They may have a itchy mouth. They may have a swollen face. They may have a tongue swelling or swollen lips. Now, these are the commonly seen things. What a patient may also feel is nausea or vomiting. Now, food allergies usually present immediately after having a particular allergen or food containing a particular substance which a person is allergic to. Now, more often we see that patients may complain of abdominal pain, which is a sign of food allergy when somebody consumes something which they're allergic to. Though abdominal pain is not very common in the adult population, it is extremely common in the children who have food allergies. Very severe food allergies may cause somebody to have trouble breathing, and this usually happens because their larynx or the voice box gets swollen, and which basically obliterates the passage of air into the lung. Patients with food allergies may also complain of dizziness, and a rare but a frequent symptom is diarrhea, loose motions with food allergies. Now, a patient may have no reaction, may be intolerant to a certain food, or may have severe food allergies. So, a person who has no to low reaction may complain of a bad taste, annoyance, or dissatisfaction to a particular food. Patients who have food allergies may complain of an immediate or a delayed allergic reaction, which means that they may complain of symptoms within an hour after eating something, or they may have a reaction up to 24 hours after having taken something to eat which they're allergic to. A lot of my patients feel sick. They may complain of migraine, headaches. They may complain of lethargy and generalized weakness. Now, patients who have food allergies usually have a very mild to severe reaction where they may complain of a rash, they may complain of abdominal pain, they may complain of loose motions, etc. In the most severe forms of food allergy, the patient may complain of difficulty breathing, which again, as I explained to you, is because of laryngeal closure. Basically, the voice box gets swollen, causing no air to pass through into the windpipe. It is potentially fatal, and somebody who has known food allergies should inform. Now, when we speak about food allergies, let me make one small remark. A lot of our vaccines are actually made on egg media. Basically, when we make vaccines, the bacteria or the viruses are grown on a layer of egg. So, the most common vaccine which is grown on egg is the influenza flu vaccine. So suppose if somebody does have egg allergy, they need to mention it to their doctor that they are allergic to eggs so that a doctor does not give them the flu vaccine. Now, do you know what the public enemy number one is? It is this. It is dust. This is called the dust mite. Now, when you look at dust, you look at something which sticks to your finger when you wipe your finger across something, but it is much more than that. It is the feces of the egg of the dust mite which you see everywhere. It is this lethal bug which is found everywhere you live, in your home, in your car, and this is what causes allergies. Now, what does this do? This little enemy eats our dead skin. It's microscopic. You cannot even see it with the naked eye. So you need to use a microscope to see this little creature. So wherever you sit, you are constantly shedding skin. And this shedded skin is actually cleaned up or cleared by nature in the form of this dust mite. Dust mites are found very often in your carpets, in your upholstery, in your linen, in your mattress. So what happens is most patients who have dust allergy complain of dry, itchy eyes, watering of the eyes. They complain of sneezing, coughing, breathlessness. Some have chest tightness and wheezing, and some may complain of rash. Now, the most common type of dust allergy is the bed mite allergy. Now, these actually fill up your entire mattress. The mite feces are present in your mattress. It is found in your linen. It now, how do you realize that you may have dust allergy because of bed mite? Now, most patients complain of sneezing early in the mornings when they just wake up, or they complain of itchy eyes, they complain of sneezing, they may complain of coughing in the middle of the night. And this usually happens because of the presence of bed mite or dust in your mattress. So, how do you take care of this? You make sure that you change your linen every day. If not, at least wash your linen every alternate day in hot water. Sun your mattress. Basically, allow sunlight to fall upon your mattress. Deep clean your mattress whenever possible. If you can vacuum your mattress, even better. Now, very old mattresses or mattresses which are teeming with dust mite would rather be changed than clean all the time. Another very important thing that you can do to reduce the effects of the dust mite in your mattress is covering your mattress with a mattress protector, which is an impermeable plastic sheet covering a mattress. Now, when we speak about skin allergies, patients have a very different way of presenting with regards to the skin. Some patients may just have a blister on their skin. Some have a uniformly red lesion, which basically means they have a red colored mark on their skin. Some patients have a red blue color lesion, which is basically a patch. And very important is this sign. What do you see here? You see a target. So these targetoid lesions are basically ones where a patient has a central red mark followed by an area of clearing, again followed by a layer of redness, again a layer of clearing before you see this surrounding red layer, which is basically inflammation or your body's reaction to the allergen. And some patients may have a very disseminated or a very scattered lesion, which can happen anywhere across the length and breadth of the body of a patient. Now, the most common or the most frequently seen allergies are your nasal and sinus allergies. Patients complain of red, dry eyes, which are very itchy usually. They may have watering from the eyes, but still complain of feeling as if there is sand in their eye. Patients may complain of sneezing, a congestion or blockage of the nose, or they may have runny nose. So it's important to understand the difference between a watery nose and a nose which has white, yellow, or green secretions. Usually, allergic rhinitis or allergies of the nose cause somebody to secrete a watery secretion from their nose, as against a white or a yellow or a green discharge when somebody has an infection in their sinuses or their nose. Uh, Other allergies which patients very often complain of is a itchy or a sore throat, which can also result from a postnasal drip, which basically means that there is secretion from the back of the nose which is flowing into the throat and causing an irritation there. And this can result in a patient having something called chronic cough, or a cough which is not getting treated or which is not going despite multiple treatments. Now, the most important aspect of allergies is to understand what is anaphylaxis. This is a life threatening condition. This is somebody with the most severe form of allergies. It's a very severe reaction which can kill you in minutes, a matter of minutes. And how does a patient present with anaphylaxis? He may have coughing, shortness of breath, wheezing, chest pain, or chest tightness. He may complain of tightening of the throat. He may complain of difficulty swallowing. And all this happens because the patient's loose tissue around the throat becomes edematous, becomes swollen, and thus narrowing the area which is connecting to the lungs. Now, because of lack of passage of air, the patient chokes, and this choking can result in immediate death. Patients with anaphylaxis may complain of skin manifestations such as hives, or which are basically rashes on the skin. They may have swelling on the skin, they may complain of itchiness, and there may be a widespread or generalized redness on the skin with a feeling of warmth on the skin. Patients who have anaphylaxis, which is the most severe form of allergy, are usually very anxious. They may be confused and have a headache. They have a feeling that something is about to happen to them, a feeling of impending doom, as if something nasty is going to happen to them. Such patients complain of fainting or turning blue or pale, and they may be dizzy because of the low blood pressure which results from anaphylaxis. They may have a weak pulse and go into a sudden shock with loss of consciousness. And patients who have severe anaphylaxis may also complain of nausea, vomiting, loose motions, abdominal pain, or cramping. So when you see somebody with a very severe reaction, you should rush out to a medical professional for immediate medical care. Now, these are the different features of anaphylaxis. Now, anaphylaxis is a result of a very severe allergic reaction, which causes the blood vessels to start becoming leaky. That means there is accumulation of water in the areas, the loose areas of your body. So it could be your lips, it could be around your eyes, as we see in this young child and the elderly lady, or on the lip, like we see here. But you see, he has other allergies too. He has a targetoid lesion, a target shaped lesion in the middle of his chest. He has another targetoid lesion on his left shoulder, and he has different manifestation of skin allergies over his cheek and his upper torso. So if somebody has this kind of a reaction, you would rather not wait but immediately shift the patient to the hospital closest to you. Now, something that we were all waiting for, the highlight of the talk today, asthma. And we will understand what is asthma. Now, asthma is a very common disease. A little research that I had conducted in the year 2015 and 16 with about 20,000 children in the city of Bombay found that 1 in 5 school-going children had signs and symptoms of asthma, though most were unrecognized by their parents or pediatricians because they were not consistent. Now, what is asthma? Asthma is a common variable disease presenting with different symptoms such as breathlessness, coughing, wheezing, or chest tightness. What do the patients complain? The patients may have difficulty breathing, wherein they complain of breathlessness even at rest when it is very severe. So, a patient may complain of breathlessness while climbing stairs or while running, which he never complained of before that. A patient may have a cough. He may complain of cough which is dry or wet. He may have a very small quantity of phlegm, which is usually very sticky and round. The patient, because of breathlessness and lack of oxygen, may complain of their skin turning blue. Patients may have wheezing, which is a whistling sound which is felt in the chest. Very often, patients with asthma also complain of chest pain, which is characterized by a feeling of some chest tightness as though somebody is squeezing the chest tight. Patients with asthma symptoms often have fatigue and headache because of increased carbon dioxide in their body for the lack of exhalation of air, and they may complain of breathlessness of varying intensities. Now, what is asthma? Now, what we see on the left is a normal airway where a patient's tubes or breathing tubes are all open. Now, when somebody is exposed to which could be anything which a patient is allergic to, the tubes of his lung squeeze tight, the walls become thickened, the smooth muscles start contracting, resulting in reduced amount of space for the air to pass through into the lung or out of the lung. And as the disease progresses or worsens, there is significant amount of constriction of the walls of the airways of the bronchi, along with a large quantity of mucus secretion. And what makes this mucus is something called the mucociliary glands, which are found in the walls of these airways or inside the lung. Now, because there is a lot of phlegm stuck inside, the available space or area for air to pass through becomes extremely little. And now this does not happen from right at the start of the bronchi till the end, but it happens in spurts. It happens in short segments. Now, to make understanding a little easier, what we need to understand is when you have asthma, the tubes become narrow. Now, the narrowing is not uniform, as a result of which what happens is there is a bottleneck created. And this bottleneck results in air entering the lung but leaving in a single file. That means the amount of air which can escape out of your lung when you exhale becomes successively larger as your lung functions worsen, as your asthma worsens. It comes to a point where your lung functions start dropping and patient becomes progressively more fatigued, breathless. Uh, Now, because of this bottleneck, patients often complain of wheezing. Now, to understand this, why do they wheeze? We can never whistle with the mouth open, but we can easily whistle when the mouth is when we pinch our lips. So similarly, when the airways are pinched or when they are in a state of constriction, very little air can pass through or rather squeeze through these tubes. And while the air is squeezing through this tube, it creates a musical sound which we know as wheezing. Now, when there is a bottleneck, what happens is the amount of air which is stuck inside the lung gradually keeps on increasing because of lack of ability to get out of the lung. This results in the lungs extending or hyper expanding, and the lungs become larger and larger, ultimately resulting in them pressing upon the ribs, which are a solid bone, uh, which results in the patient complaining of chest tightness. Now, why does a patient have a chronic cough when he has asthma or bronchitis. Now, every time you see somebody having asthma or bronchitis or somebody who's coughing, try and understand what's happening is there is a bottleneck created in his lung and somebody is trying to undo that bottleneck. That means somebody is trying to push open this little bottle of champagne, and when the person is finally able to push through this bottleneck, there is a celebration in the form of a cough. So patients who are coughing are actually trying to clear the bottlenecks which have been formed in the airways because of either bronchoconstriction, which basically means narrowing of the muscles of the lung, or because of mucus plugs. So, not everybody with bronchitis or allergies will complain of a wet cough, but the symptoms of cough will persist. So, not everybody with asthma will have a very uh, a large copious amounts of phlegm, but a select few. Now, as I explained to you, asthma is a form of allergy, an allergy where a patient complains of breathlessness, chest tightness, etc. So, what triggers this asthma? The most important is pollen, bugs. So, indoor air pollution is a very important factor in triggering your asthma. Uh, Patients who usually have plants at home, or when they travel to rural areas, there's a large quantity of pollen around the homes or in the fields which can trigger your asthma. Bugs in the home trigger asthma in a multitude of ways. It could be just the different vomitus of the bugs, or it could be because of the common insecticide that we use to kill the bugs at home. Chemical fumes are a very important trigger for asthma, and today a lot of people do not move out of their home without spraying a little deodorant or perfume, which basically is or is chemicals in a gaseous form, which could enter different parts of your body, such as your nose or your lung, and result in allergies. Very cold air also triggers asthma. So, what happens is in asthma, your body or your lung cannot tolerate a change. A sudden surge in air temperature or a sudden drop in air temperature results in cold or very hot air entering your lungs, creating a defense mechanism to be adopted by the body in the form of bronchoconstriction, or the airways becoming tightly shut to prevent any damage to the insides of your lung by very hot air or very cold air. Now, ubiquitous in a city like Bombay, which is sitting next to the Arabian Sea, are the fungal spores. High amounts of humidity, followed by presence of rural areas with fields and plants, becomes a very important factor for presence of large amounts of fungal spore in the air. Dust. Common house dust is the most common reason for most allergies across the world today. However, there are different dusts which we can mention, such as construction dust, dust from building demolitions, etc., which also are adding to more and more asthma trigger. Something which bothers me a lot today is the presence of smoking, and cigarette or any form of tobacco smoke can trigger an asthma attack in somebody who is very prone to allergies or asthma. Strong odors in the form of deodorants, perfumes, strong odors in the cosmetics that we use are a very important source of indoor air pollution. Today we speak about pollution and we only limit ourselves to outdoor air pollution. But what is of importance is the presence of indoor air pollution, which happens because of the presence of dust, smoke. Now, smoke can be from different areas of the home, such as when somebody is cooking a barbecue, or they're using, agarbatti and dhoop, etc., which can trigger an asthma attack. Stress, obesity, are and anger are very important factors in triggering asthma, and it is extremely important when you are treating somebody with asthma to address their triggers, because unless you stop a person from triggering his asthma, his symptom control will never be achieved. Now, what is the first aid that you can provide to somebody who has asthma and has not uh, received medical attention yet? Make sure that you sit the patient comfortably upright, give them 4 puffs of their blue or gray reliever inhaler, which basically are inhalers which act quickly to open up the airways. After giving the initial 4 puffs, if the patient is still breathless, you, after waiting for a period of about 4 minutes, you may give additional 4 units of the inhaler while you call somebody or instruct somebody to call some healthcare facility such as an ambulance. Now, when you are providing first aid to a patient with asthma, it's important that the patient use a device called a spacer with their inhaler, because what happens is the speed of the plume or the speed at which the medicine comes out of the inhaler is not matched by the patient while he's breathing in, resulting in an abnormally excessive deposition of the medicine in his mouth or throat. Now, when we speak about asthma, very often patients feel it is one inhaler or one type of inhaler without realizing that I have a big number of inhalers or different types of inhalers which I can offer you. If not inhalers, I could offer you even nebulization. So it is extremely important that a professional treats your asthma, somebody who has an understanding of the different devices available for asthma, somebody who understands different medicines available for your asthma. Because what happens is when you are treating your asthma or allergy, it's extremely important to be very focused and very disease specific while also addressing all issues of the patient's concerns. Thank you. I will open up for questions and I would encourage everybody to ask me a lot of questions.
Thank you so much, Doctor. It was such a lovely, detailed explanation, and you explained it in such a lovely and very simple manner. The way you explained using the example of the bottleneck in the lung, it was very interesting. And also, I like what you covered when you said that, how you can get rid of dust mites in your linen and the different triggers for asthma, which includes fragrances, perfumes, even agarbattis. It was very interesting, very insightful. Thank you so much. We will now take some questions from the audience, Doctor. So I have the first question from Nishant, and he says he has a recurring cold for more than 6 months. Is he at risk?
Nishant, at risk for?
He has a recurring cold. For 6 months, the cold is persistent. It doesn't seem to go. So, does he? Is there any kind of risk? Could it be asthmatic, or maybe he just needs to go to a doctor, get himself checked? As per your experience, can you share some insights on that?
So, Nishant, it's extremely important to understand what you have. You have a blocked nose, you have a runny nose, which hasn't been addressed for 6 months. You need to seek proper medical attention, ideally with a chest physician or an allergologist, an allergy specialist. Now, what's important to understand here is that you are having an allergy to something which you and I don't know of. So it would be important that you sit down and question yourself as to what or when your allergies in the nose get triggered. So once you understand that, you will be able to understand that why you are having this allergy, why your nose is blocked, and then we can offer you different treatment options. Uh, Now, what are the risks? The risks are frequent infection. So, what happens is patients who have a chronically blocked nose complain of secretions pent up in their sinuses or secretions which go into their ear, causing sinus infection or ear infection. This infection can go up into the brain also because the nose and the sinuses are right adjacent to the brain. Now, are you at risk? That's one, that's risk of infection. Two, are you at risk for asthma? Now, you're not really at risk for asthma, but it is important to understand that once somebody has allergies or somebody is prone to allergies, he may have different types of allergies at different times in their life. Now, no two persons would have the same set of allergies, but if you do have allergic rhinitis, you may also have a propensity or uh, you may be at risk for developing asthma, though you may have never understood the symptoms of asthma. So, very often, doctors and patients don't like to hear the word asthma, so they will mislabel this as bronchitis, so or allergic bronchitis. Now, by definition, asthma is a very specific disease in which somebody's airways become inflamed. That means the airways shut down, which is for a considerable period of time. But when the airway is subjected to a bronchodilator, that means medicines which are given in an inhalational form, their lung functions or their airway, the diameter of the airway opens in such a way that the patient is able to expel or exhale out about 200 ml more air or more than 12% and 12% more air than they could before the bronchodilator or the inhaler was given to them. So, in short, are you at risk for asthma? Yes, you may have asthma.
Thank you, Doctor. Hope, Nishant, this answers your question. Next question we have is from Mr. Harbaljit Singh. He wants to know whenever he's out in the daytime, his skin is exposed to the sun, and because of the sunlight, it becomes red and it becomes very itchy. He would like to know what is the reason and if you could help for that.
So, good evening, Mr. Singh. What you're describing is a very common phenomenon called photosensitivity, which basically means you are having an allergy of the skin because of sunlight. Now, it's extremely important that when you are photosensitive, that means you have allergy to bright lights or sunlight, you cover your skin in a good layer of a high SPF sunscreen lotion. Try using full sleeve clothes. Try covering all parts of your clothes of your body with clothes. Uh, Cover your head with a hat. By hat, I mean something which is circular and covers all sides of your head and not a baseball cap. Uh, and try and so over a period of time the photosensitivity reduces, but you may also want to find other triggers along with the photosensitivity which may be causing your allergy.
Understand, doctor. Thank you so much. Next question we have is Manoj. Very interesting question. He wants to know, is homeopathy a better solution than allopathy to treat asthma or allergies?
Manoj, what we have to understand about allergies and asthma are these are chronic diseases. They are usually hereditary. They get passed on from parents or grandparents to their children. Now, this is a way a body is reacting to something. Now, this reaction, when it is abnormally excessive, results in allergies. Usually, patients, get frustrated because of the chronicity of their illnesses and they give up hope on allopathy and they go on to homeopathy, which results in extremely slow desensitization, which may happen because with just with time, or it could be because of the effectiveness of the homeopathic medicines. I am a strong proponent of the allopathic form of medicine and have very little or no confidence with homeopathy. I would suggest we leave homeopathy for the homeopathy experts to practice, of which very few are left in our country now. We should identify the triggers. A little self education goes a long way in treating asthma more than just allopathy or homeopathy.
Understand that, doctor. Thank you. We have a next question from Mr. Virasat Khan, and his question is,
Yes, she
yes,
does.
can you hear me, doctor? Uh, Mr. Virasat
Hello?
Khan, yes, I am being able to hear you, doctor. Can you? Am I audible?
Hello? No, I missed you for a moment there.
Okay,
I
I will
missed your
repeat
question.
myself. I will repeat myself. We have a question from Mr. Virasat. He needs to know what are the medicines asthmatic patients should take to avoid breathing problems which come all of a sudden.
So, when somebody is having an asthma attack, he should use his inhaler as prescribed by his physician. Now, when we treat asthma, we have two different sets of medicines. One which are used to maintain their asthma, and one set of medicines which are called the relievers, which are usually used to prevent or rather take care of the patient's symptoms in an emergency. Now, over the past 15, 16 years now, a lot of changes have happened, and we have a new drug called formoterol budesonide, a combination of formoterol and an inhaled corticosteroid called budesonide, which can be given as a single maintenance and reliever medication, which basically means that it acts very well as a maintenance medicine, but it can also be used as a reliever in times of an emergency. Uh, I would not be able to prescribe drugs to you right now or tell you what medicines to take when somebody is having an asthma attack. It is extremely important that the patient is treated in an emergency by his physician, by a medical expert, and not a layman.
Understand. Next question we have is about allergies and asthma being hereditary. There's Sushant who's asking us that as a child, he never had any asthmatic problem or allergic problem, but he has certain symptoms now, and his doctor thinks it is bronchitis. Is there a difference between this, and what's the exact solution to this?
So, as I was explaining to you earlier, somebody who has may have asthma. Now, before I explain what asthma is, there are many illnesses which can mimic asthma or which can present with symptoms such as breathlessness, cough, wheezing, but may not necessarily be asthma. So it is extremely important that the diagnosis of asthma is made by somebody who is an expert. Now, bronchitis is a term very often thrown around by the doctors because very most Indian patients or most patients across the globe consider the diagnosis of asthma as a death sentence, which is not true. So they feel that they become handicapped with the diagnosis of asthma and they cannot function adequately because of their symptoms or because of their illness. They believe that if you have asthma, you are going to be perpetually breathless, coughing, wheezing, and constantly using inhalers or pumps, as they are commonly called, and maybe even on oxygen, which is not true. Now, it is hereditary. So we see different types of asthma. There are several different varieties of asthma, and not all asthma start in childhood. There are certain asthmatic syndromes, such as asthma in the elderly. We see a very distinct group of asthmatic patients in young women in their early 20s or early 30s who probably have certain factors which are going against them before they present with asthma. Then you may have a group of patients who complain of breathlessness only at work, which is called occupational asthma, or you may have a certain set of people who have symptoms of asthma only when they exercise. This was a phenomenon commonly seen in athletes who are breathing very fast, running in colder environments. Now, exercise induced bronchial asthma is usually because a person, while he is exercising or running, is breathing in large quantities of air which are not humidified and warm before they enter the lung, resulting in the airways getting constricted. So, does that answer your question, Shashank? That you may not have asthma but still have bronchitis? Very often, bronchitis is a term which is used interchangeably with asthma until we prove it by a special test called pulmonary function test or spirometry.
Got it, doctor. That was pretty detailed. I'm sure it would help Sushant address his queries. We have another question from Robbie. He needs to know if someone has suffered from COVID 19 in the past, what are his chances of getting a lung disease?
Sorry, I could not follow the first part of the question.
Okay, so the question is if somebody has suffered from COVID in the past, what are his chances of getting a lung disease?
Whose chances of getting a lung disease?
If somebody has basically suffered COVID, he's been a patient of COVID 19. So, is it likely that he would suffer from a lung
Okay,
disease
I
in
got
the
it. I
future?
got it. Am I audible?
Yes, you are.
So somebody who's had the COVID-19 infection, which has affected his airways or affected his lungs, definitely has a lower immunity. He may develop secondary infections in the lung, but until now, after treating patients with COVID for a year and a half, we have seldom seen anybody coming with post-COVID lung infections. But very often we've seen patients may have certain amount of areas of the lung which are compromised post-COVID, which appears to be an interstitial disease, but is actually not. It gets better over time. So somebody who has had COVID, it is important that he maintains his lung health, treat his underlying lung conditions such as asthma or COPD or bronchitis, or if he is a chronic smoker, strongly encourage him to stop smoking. Somebody who's exposed to certain forms of biomass fuel, which basically means burning wood, etc., we strongly suggest they do not do so to prevent any further lung damage. And uh, I would strongly recommend everybody to vaccinate themselves against Streptococcus pneumoniae and the influenza. Now, the Streptococcus pneumoniae vaccine is once in 5 years, and influenza or flu shot is an annual vaccine which changes every year, most likely in the months of April and May.
Sure, doctor. That was pretty insightful. Like, I wasn't aware of these two vaccines you spoke about that one needs to take annually. I guess there needs to be more awareness in, for these kind of vaccines, and the people need to know much more about this in detail. Anyways, thank you for answering that. I have one question from Mr. Kafil, and his
Shiraz, I
question.
lost you.
Okay, so yes, can you hear me now?
Shiraz, I lost you.
Okay, am I audible?
Sorry, yes, I could not hear you for a moment.
No, okay. So I was just coming back to that question which you addressed, and you spoke about the two vaccines that one can take, annual vaccines. I was just sharing my views that I don't think many people are aware of these vaccines, and it would be good if there was, an awareness for the same with the common people.
Yes, we are doing that. And on this Sunday, in collaboration with some vaccine maker, We are running a social media campaign and a talk. This is more directed towards doctors right now, but we will be happy to allow audience participation if somebody is interested. Uh, yes, what's another important thing is adult vaccination has not kicked off very well in our country until now because it may be frighteningly expensive for the government to vaccinate every citizen of the country. So eventually, as we advance, as our country prospers, our country may include adult vaccination as a strategy to vaccinate every adult individual in our country, which we are doing fabulously well with the current COVID vaccines.
Got it, doctor. Thank you. Next question we have is from Mr. Kafil, and his question is, what do you do for a kind of a skin allergy where your blood vessels leak?
So when somebody has a skin allergy, it's extremely important that a professional takes over. The doctor would oftentimes do a biopsy when they have leaky blood vessels to identify the type of allergy. And this therapy or the treatment would depend upon the kind of disease. Very often, this is because of over or excessive immunity and an immune reaction occurring. Uh, and so, as I said, it's very disease specific, but as a blanket rule, steroids would really help in suppressing the immunity or the excessive immunity to prevent further damage.
Understand, doctor. We have still a few questions. If time permits, can I take the liberty to ask you a few more
Yes,
questions,
please.
please? Okay,
Yes, please.
thank you. Next question we have is from Dinesh, and his question is, if one has a habit of sleeping on the chest, can that affect one's lungs and his or her respiration?
Usually, everybody tries to find the most comfortable position to sleep in. So, if suppose somebody is sleeping on the chest, there may be a medical reason why he's doing so, because he is most comfortable while he's sleeping on his chest. If you are uncomfortable in a particular position, you will not be able to sleep in that. So, very often you have to identify why somebody is sleeping on the chest. There may be problems ranging from a blocked nose to sleep apnea, which causes somebody to sleep on their chest and not on their back. The
Sure.
other question which you asked me was, can it affect your lungs? Sleeping on your chest does not affect your lungs in any way, but it is important that when we are growing or when a child is growing in the infancy, they are not made to sleep on their chest, but rather on their back. But especially on soft mattresses, because that can sometimes compress the chest, and the child who is very young may not be able to move into a more comfortable position and may choke.
Oh, okay. That was good to know about young parents. It's a good insight for them. Thank you. Next question we have is from Shraddha Gala, and she wants to know, in case she forgets to carry a inhaler, how can she take control of her asthma and the situation? What can one do?
So it's extremely important, Shraddha, that everybody who's an asthmatic may not need inhalers all the time. I'm an asthmatic, I have not used an inhaler in the past 7 years. So who is somebody who needs an inhaler all the time? Somebody who has poorly controlled asthma, uncontrolled asthma, or severe asthma needs to move around with an inhaler in their bag. Inhalers now are extremely small, compact, and they have multiple doses. So it's easy for somebody to have multiple doses in one single inhaler. Now, if you aren't able to get an inhaler, you need to seek medical help in case you have excessive symptoms. I hope that answers your question, Shraddha.
I'm sure it does, doctor. Thank you. Next question is from Abhinav, and he wants to know which are the good exercises one can do for their lungs.
So usually when we speak about lung exercises, so you have different sets of exercises. Cardio is the best form of exercise for your lung. Walk for 45 minutes to an hour every day for at least 5 days out of a 7 day week. Or somebody needs to do upper limb strengthening exercises. Patients who are asthmatic or have chronic bronchitis are made to do certain exercises which help strengthen the diaphragm, which is the most important muscle for breathing, which separates your chest from the abdominal cavity. And while doing so, what the patient does is usually he presses upon his abdomen in the center while trying to take a deep breath. And in doing so, what he does is he creates resistance to the movement of the diaphragm and hence strengthens the contraction of the diaphragm. The other exercise which is extrememely important is strengthening or rather pursed lip breathing, which basically means that patients with asthma, chronic asthma or COPD exhale out air for longer periods of time than they would otherwise by making a forceful contraction against a pursed slip. And by doing so, what happens is they open up the bottleneck. So these are the simple exercises which we usually prescribe for patients with airway disease, that's asthma or COPD,
Yes, doctor. Are you being able to hear me? Am I audible? Hello? Hi, doctor. Are you there? Doctor, next question we have is from Rubina, and she has a question where she needs to know if allergies and asthmas can be treated differently.
I think this is a repetition of what we spoke about allopathy versus homeopathy. So it's extremely important to understand that allergies and asthma can be controlled rather than be cured. So you may treat them differently. The most important thing is avoid the allergen. So allergen avoidance is the primary mainstay of treatment when you speak about asthma or allergy, wherein a person prevents himself from getting exposed to something which bothers him. The other important thing that we need to understand is ideally the patient is tailored, a therapy for a patient is tailored. That means we give a disease specific, patient specific treatment, and no two patients may require the same set of medicines. And the other thing is when we speak about treatment of asthma, make sure that the person is not smoking or exposed to any form of strong smells or not exposed to any form of smoke. Shiraz?
Yes, doctor, I'm there. Okay. Thanks, doctor, for answering that question. We have a next question about can pranayama benefit our lungs? Is it helpful, that exercise?
Pranayam is a very good exercise provided learned the right way by a yoga expert. I would strongly recommend everybody to learn the pranayam exercises to have a better, larger, healthier lung. Another thing that I wanted to speak about was a study done many years ago, probably in the year 2010, 11 years from now, was that we found that Indians or Southeast Asians have lung capacity or lung sizes which is about 30%, mind you, 30% less than the Caucasians or the whites. Now, the primary reason for that is when we are or while we are growing up, we have very frequent lung infections. We have very frequent respiratory infections, which prevents the growth of our lung. Very often, what happens is when a child is growing inside the mother, the nutrition is poor. So the patient sizes or the size of the fetus is usually small. This is something which we will overcome slowly as a whole society with each passing generation when we take care of respiratory infections by experts in the early childhood or early or the growing years of a patient.
Understand, doctor. A next question we have is from Shaz. He wants to know how can one know the different kinds of allergies that a person may have? What are the different tests you may do to really know that you are allergic to something?
So, I usually do not uh, straight away jump into doing tests. The first most important test that anybody can do is to jog your brains. A very important part of finding allergens is a good quality interview with a patient. There is no substitute to that, followed by identifying different triggers by the patient. If not, a doctor may assist him in his place of work or at home. And ultimately and finally, the gold standard for identifying allergens is a skin prick test, which is a test which tells us exactly what a patient is allergic to.
Sure, doctor. Thank you for addressing that. I had a question. Basically, I see many people who have this dust allergy, and every day in the morning they have this series of sneezing which happens, and it's just unstoppable. So, is there a cure to this, or is it
Uh,
due to some particular reason that they just keep sneezing every morning?
so when I was speaking about home environment or indoor air pollution, uh, the most important reason for somebody to wake up with sneezing or wheezing or breathlessness or runny nose, teary eyes, is that there is some pollutant, some allergen present in their immediate vicinity of where they were sleeping. The most important factor for my practice would always be the mattress. And I often encourage my patients to change their linen every day. I always tell them to cover their mattress with a mattress protector, cover the pillows with a pillow protector. If not, use washable pillows where they wash their pillows at least once a month. The other important thing that they can do is to keep the room where they're sleeping extremely clean. Make sure there is no dust, knickknacks, and the home is minimalistic. uh, they should avoid use of diffusers or air fresheners or any form of aerosol in the bedrooms where they are sleeping. So these are the very common general advices that we give to our patients who wake up sneezing. But it is extremely important to also manage these symptoms, whether with nasal decongestants or nasal sprays. It depends upon each patient.
Got it, doctor. I think this brings us to an end for all the questions which have been asked. Thank you so much, Dr. Aditya, for taking out the time, enlightening us on how to prevent allergies and asthma as well, and also helping us create awareness about this
Thank you
disease.
so much.
Is there any last piece of advice which you would like to give our audience before we close?
Diwali is around the corner, allergies are around the corner. When you're cleaning your home, your spring cleaning for Diwali, make sure you're masking up, make sure you're not doing dry dusting, make sure you're using a damp cloth to wipe off all surfaces. This Diwali, make sure that you are not, bringing out all your wares and keeping them all over the home to collect dust. Uh, Avoid use of firecrackers if possible. Avoid use of unnecessary aerosols. which I mean diffusers, etc. And stay safe.
Very well said, doctor. That was just in right time for Diwali. So, everybody in the audience, do take care of yourselves. It brings us to the end of the session. Hope you had a good time and got all your queries answered. Thank you so much, Dr. Aditya, for spending time with us and
Thank
enlightening
you.
us. Until then, we will come back again with a series of more sessions for the audience. Till then, stay safe and take care, stay healthy, and take good care of yourselves. Thank you for joining us.